Good morning.
Good morning.
All right, so we got a little audience here. So back. Hey, my name is Jason Griffith. I lead our patient marketing and our nationwide advocacy strategy for SK Lifescience. Today I'm going to provide you an overview, high level of XCOPRI, and then some of the resources that we as SK Lifescience have to support the medical community. One of the things I want to share is I am not a medical professional, so I cannot provide any medical advice at all, but there's plenty of healthcare providers here at this conference that you certainly can ask, as well as talk with your own special healthcare provider if you or your loved one is impacted by epilepsy as well. But I will try to make this as informative as possible as you all join me in this talk today. So, today I'm going to talk about the patient brochure for XCOPRI that just came out. Actually, it just got launched today for the first time ever. And I'm just going to provide the key information there as information and resources for anyone who is interested to know more about XCOPRI that we can provide for you as well. And I'll also provide some insights on why we have chosen to do what we do on the marketing side to bring these messages out, to build awareness, not just with XCOPRI, but to support the epilepsy community as well. We're also going to talk about social media, because what we've seen is that the epilepsy community is very active in social media, and what we hear and what we see is people who are impacted by epilepsy and seizures, looking for information, but a lot of times they want information from other people and families who are impacted by epilepsy, so that's also important for us as well. We're talking about the SK Lifescience Navigator, because anytime you bring up a product or a treatment as an option, can I afford it? And so, we're trying to provide avenues and channels to help people, if XCOPRI is an option that your healthcare provider wants to try for you or your loved one, then that's something that we want to try to help with there, just in case your insurance does not cover it, at least early on. And then lastly, the STEPS discussion tool. It's something that we launched in 2019, a tool that was developed to help families and people impacted by epilepsy to have better conversations, to reframe that focus of, each person who's impacted by epilepsy, you have goals, and it could be simple goals, stopping their seizures, or it's maybe someone who wants to finish and get back to work or go to school, or there's each person has their own unique story, but we're trying to help guide those conversations as well. So let's talk about this. So this person here, actually, I'll say it's Coral. She's on the cover of our brochure. She's actually someone who was in one of our clinical trials. She's based out of Austin, Texas, and has a pretty phenomenal story about her impact as well. And every person you will see in each of these slides are actual people that I fortunately am grateful enough to have gotten to know, who've had unique and transformative stories with regards to treating their seizures as well. So my goal is to show real people who've been impacted, and a diverse group of people, so that as you look at someone who says, what, that looks like me, or that's like me as well. Because one of the things we hear, just through immersing ourselves in the world of epilepsy, is a lot of people feel like epilepsy and seizures are very underrepresented in media and just in conversations. And we hear people say, I've never, I've gone in situations where people go, I've never met someone else with epilepsy. And then, you find out that the person next to them, they have epilepsy as well. And I've literally watched best friends be made in meetings that I've had where I brought people together who had never met, just because of that bond, and an unfortunate bond, you must say, as well. So, not sure where that came from. All right. So, do you first starting a new anti-seizure medication? So, we've heard this time and time again. Many people and families who've been impacted by epilepsy for many years, you've tried a bunch of different treatments. And over time, you've heard some people say that, I'm hesitated about starting another treatment. Your doctor brings up, hey, you're still having seizures, let's try something. And so we want to address that. Maybe there's a concern about starting a new treatment. And XCOPRI is one of those that you may be there as well. So we want to identify that and say, hey, reality is that, you've tried treatments over the years and you didn't get what you needed, or your seizures got worse. I mean, different people have their own experience when they're starting an anti-seizure medication. So we want to address that as well. But then we want to provide what we can around XCOPRI that we can tell you that maybe it's worth you, to explore if you continue to have seizures as well. So one of the first things people want to know is, can XCOPRI help me? Well, what we've seen is that in our clinical trials, the average reduction of people's seizures was about 55%. Now, we have a population of about 1 out of 5, or 20% of people who were prescribed XCOPRI had their seizures completely reduced to 0 seizures. And again, it's about 1 in 5 have experienced that as well. And that's great for some of those people as well. But then you have other people say, I've had seizures for every day or every month, and they've got it reduced to maybe they're having seizures once every few months. I mean, each person is unique, but we've seen those results as well. Also, I mentioned that, I should say this, XCOPRI is indicated for the partial onset treatment of seizures or focal aware seizures, and it's for adults 18 and over. So if you have a child that's under 18, I can't provide any kind of information there. Everything's on adults more, but again, you can talk with your healthcare provider as well. Of course, with any treatment out there, we all know that many anti-seizure medications are known for their side effects as well. XCOPRI is no different. Our top 4 most common side effects that we find is feeling sleepy or tired, which I've heard from many people I've spoken with who've been on this, and that's something they've dealt with. Dizziness is another one, blurred vision, and headaches as well. And of course, there are other side effects that have been found, but these are the top 4 that have been found in our clinical trials. And of course, if you experience, if you're on XCOPRI and experience any side effects, somebody let us know and we can report those as well, because XCOPRI's been around for 3.5 years now, and if there's something that it may have caused, let us know and we can, we can report that as well. What's important for us is to build stories. People want to say, hey, they hear from the healthcare providers, we hear, well, my doctor doesn't have epilepsy, or my doctor doesn't suffer from seizures, my doctor doesn't take anti-seizure medication, so what do they know to prescribe this? They say this works, but I want to hear from other people's experience. We've been very fortunate that each year we start adding more and more stories of people's lives, and the diverse stories of actual people who have been on XCOPRI, and they've had, in some cases their seizures were eliminated or they were significantly reduced. And so we try to have a diverse group of stories there as well. That these stories are on our website, but also on YouTube as well. And we'll talk further about those. Can I afford XCOPRI? Of course, I mentioned this earlier. With any treatment, can you pay for it? What we do know this: at least 90+% of people, if you've got insurance, XCOPRI is covered. The average copay most people should be getting is around $20, but some people say, well, I pay much more, I may pay a couple $100. Again, it's based on different people's insurance. But we do have a program called the SK Lifescience Navigator that helps people with coverage and costs as well, and I will talk about that in a few minutes as well. Just likes to go fast. Sorry. So when I talk about diverse stories, when I look at each of these people here, I've had the pleasure of being in each of their houses here. You've got Coral here on the left, who represents, she's bilingual. One of the things we're trying to do in diversifying and reaching different populations of people here in the United States is even the Hispanic community. We've been told, that there are challenges in that Hispanic community in the perception around epilepsy. So Coral has her perspective that she's experienced, growing up with seizures as well. Then I've got Kaylee and Alan there in the top middle out of San Francisco. They have, that story was just published a month ago as well. To the far right is Natalie Beavers out of Atlanta, Georgia. She started an organization called Angels of Epilepsy because her story is inspiring of being a fighter, having seizures for 42 years now as well. And then down below is the Tucholsky family. They're also out of Georgia. Their son Kyle, and again, all these stories are on our website and also on YouTube as well. Kyle is nonverbal, and he was having multiple seizures each and every day for many of his life, and he's tried multiple treatments. But through their experience, they found that on XCOPRI, they're down to 1 seizure a week or so on average, but it's been positive for them as well. And to the right is Laura. Laura is our latest story. She's 63. She actually got diagnosed when she was 57, so later in life in her diagnosis as well. And just an inspiring person out of Cleveland, Ohio. So, Social media, we have a couple resources there. Again, a lot of people like to go to YouTube. It's actually, what's interesting is that it's the #2 biggest search engine. Most people Google things, but the second one is YouTube. So we made a point to put all these stories there, but also other educational videos are also found on the website. And then we've also have ads out there as well to build awareness around, the potential what could happen. We do have a guest that's in here in the audience. It's also up there representing one of our social media posts. I won't call them out, but I'm just glad to see them here today as well. So this is SK Lifescience Navigator. So this is, if you're prescribed XCOPRI and the cost of it is more than you're able to afford, this is a program we have that's available to help people to get XCOPRI, because our goal is to make sure if you have seizures and you're on XCOPRI and it helps you, we want to make sure you're able to get it. But fortunately, the managed care plans are getting better about covering it as they've seen the results that it's had for people. And so we're starting to see 3.5 years outside that it's now getting better coverage. Again, there's hundreds and hundreds of managed care plans around the United States. So each person has their own unique experience with regards to coverage as well. But we're doing our best to provide resources to help with that coverage also. Lastly, we have the STEPS discussion tool. So this was developed in 2019 through some conversations we had with advocates and some healthcare providers from around the country with their input. What we've heard from many families, especially those who are early on in the diagnosis of epilepsy, is they don't know what to say or what to talk about with their healthcare provider. And many times, a family would go in and see their neurologist. The neurologist would ask, "How are you doing?" And the response would be, "We're fine," because fine for some people may be like, "Well, we continue to have seizures, but it hasn't changed, so we think this is what our normal is." And when the family or whoever responds back to saying they're fine, sometimes what we heard was that neurologists would be like, "Okay, well, their seizures are under control," not thinking these people are still having seizures. So we developed this STEPS discussion tool to help guide and facilitate better conversations that families can have with their healthcare providers. And the goal is to talk, and to keep it simple. It is to talk about your seizures. You say, "Hey, since we saw you last, we've had this many seizures," or "Our seizures have increased or they've decreased." Talk about your treatments. Maybe you started another treatment a couple of months ago or the past year. How's it doing? Are you tolerating? Are there side effects? Making sure that it's, it is providing that relief, or maybe it's not. And then emotional impact. There's a lot of aspects around epilepsy that impacts people on the emotional side that some people who don't have seizures and don't have epilepsy don't understand. But to share those concerns with those physicians so that, if we need to treat, depression or anything else as well, that it's important to have that discussion as well. Personal goals is another discussion. Each person and family has their own goals in life, with regards to where they hope to be or potential to be, with regards to the seizures. Maybe it's just, maybe you want to stop your seizures. I think that's many people's goals. But maybe it's, I just want to, to be able to drive if that is a potential option. Or maybe it's, I want to go to school. Having those and setting that foundation with your healthcare providers is, hey, we want to, treat our seizures, but we also want to hopefully have a goal down the road as well. And then safety, just a reminder, there's a lot of safety impact that you have to watch and to remind each other that, maybe it's, no swimming or, being careful if you're cooking, you have seizures as well. So pretty much provide the brochure about XCOPRI. Again, I'm not a medical professional, so I can't give you medical advice here, but there are plenty of physicians here and then your own as well. I want to leave you with 3 words. One is together. In this room and at this conference, you've got people impacted by epilepsy. You've got families. You've got advocates. You've got the best healthcare providers out there. You've got different members of industry and other companies. There are many treatments out there, whether it's surgical, whether it's pharmaceuticals, or whether it's other treatments. Together, we all have one goal, and that is to stop epilepsy. And none of us can, we need to keep that focus there. Second word from together is hope. There are people out there who've had epilepsy for many years. Some maybe as little as 2 or 3 years. Some maybe it's 23 years. But some people out there, they've given up hope. So we as a community, all of us, have to be that hope for those people who've been impacted by epilepsy and to stay strong there, to support those who are out there who may feel alone. And the third word is passion. We cannot lose that passion and that focus about how we can support each other and help the overall community as well. So thank you all. I will say, are there any questions real quick? I'm limited what I can provide an answer, but if anybody has any questions, I'll be glad to try to answer that. All right, thank you.